everyone. My capstone is a healthcare spending analysis and hopefully eventually a social policy initiative, but that's going to take some time to get there. So that's why I'm doing the healthcare spending analysis now. My current project, like I said, will be more than simply a spending analysis, but I do want to end up developing more of a rigorous analysis of the gap between the US's healthcare spending and the health outcomes. So the US doesn't do very well on worldwide standards of health, including like infant mortality, like longevity, things like that. So I just want to see if there's any healthcare related cause. But before I do that, I need to show that the US spends a lot of money in order to say that these outcomes are disproportionate. So I'm engaging with that information. Other components I eventually want to look into, maybe not all of these, but these are some general ideas I've had, is finding where the US fails in providing healthcare. And so this includes like evaluating current social programs. I wrote heart disease because that's has a very large disease prevalence in the United States. I'm considering discussing the Affordable Care Act, as it didn't increase short-term health outcomes as much as was expected. We'll see where I get on that. I kind of want to talk about like implementing paid maternity leave, maybe combating addiction, and ultimately all this is within my realm of like trying to bridge the gap between spending and outcomes. My reason for selecting this is because I have a history having to go through the healthcare system, and I'll spare you the details, but I needed 2 brain surgeries, and so being 17, I wasn't even allowed to legally sign my surgery papers, yet I was like saying, yes, I will undergo this like life-changing surgery. Yeah, sure. I was 2 weeks shy of being 18, and I just felt that like patient autonomy wasn't great, although in my case, my surgeon was very kind and let me sign like the back of the one that my parents signed. But like even after that, the medical bills, even despite having great insurance, just like made me realize that there isn't equitable access to healthcare, and that if I could barely get the care I needed, even though I was very well off, then there's a lot of people who can't get the care. And so I really wanted to like dive into that for capstone, because now I'm really interested in health policy and I want to see where I can take it. So I've done some preliminary research on spending, showing that the biggest difference between the US healthcare systems and others is like the price of pharmaceuticals and devices, and also administrative costs. So that's where like the US has disproportionate amounts of spending, but other than that, in general, most sources will say that the US spends one of the largest chunks in the world of its GDP on healthcare, because in some years we've spent double the amount that other countries do, and some years we just spend a little more. And so I just want to show that like no matter how much we spend, our outcomes are still not equal. So this goes into more administrative costs, but also having health insurance. And so I want to talk about spending in private and public insurance. Yeah, so that's where I'm at currently. What I've learned doing this is that there is sufficient evidence and data on the US's spending, and that's because it's, open government document, it's very easy, and there's some analysis on it. But I can use this to actually delve into my capstone further. Yes, this section needs to be more robust, but I've done preliminary research that has confirmed what I thought, and so in doing that, it's important for me to be able to like set a foundation for myself. So before I start those other components of what I was talking about, I need to decide how to put these together, what spending can prove. And so right now I'm really in that process, but I think this like preliminary work has really helped me. So, all right, see you on the other side.